Bismillahirrahmanirrahim. So there's a disease. It is not very common, I guess, because I just learned it from some kind of drama or series. So we have this. Grey's Anatomy. So there is a patient comes with a severe skin detachment, pyrexia, and cutaneous pain and epidermal detachment. He was diagnosed as toxic epidermal necrolysis. I was thinking if this was a true disease or something like that, because I had doubt and I didn't know much of that. So I wanted to take a research, and I found that obviously it's a disease, and it's not a made up fantasy, and it is from Davidson. It's from dermatology. So we have this disease, which is a medical emergency, as extensive mucocutaneous blistering is associated with high mortality rate. It is usually drug induced. If I um, correlate with the series or drama, the least I saw is that it can be antibiotic induced, anticonvulsant. Here we have a picture which shows carbamazepine is the root is the cause of this disease. We also have sulfonamides, sulfonylureas, allopurinol, antiretroviral drugs, and NSAIDs, terbinafine, antibiotics. So this can cause this extensive disease, toxic epidermal necrolysis. If we short the term, that is 10, number 10. So it's a kind of interesting disease. Then we have that it is erythema. It has extensive erythema, blistering, and epidermal loss. So what it happens that when a patient comes and with this disease, and you saw him or her, when you stroke the skin, gentle lateral pressure, gently pressurize the skin with your hand, and the skin will just come out, like just like that. It is called epidermal detachment, which also called Nikolsky sign, that it is skin becomes severely fragile, and blistering and mucous membrane involvement are usually usual, and there may have a hemorrhage. So it has disease severity score that we have here is a box showing that showing the scoring factor, how will we score the disease in terms of severity. So we have some factors like it mostly occurs more than 40 years of age. Of course, the patient in that series was more than 40 years. Heart rate more than 120 beats per minute. Cancer or hematological malignancy. Basically, the patient was diagnosed for something like malignancy or something. I don't remember that much, but something like that. And he was given antibiotics, and then he developed this 10 toxic epidermal necrolysis, and blood involved body surface area more than 10%. It usually affects the trunk. Especially it usually affects the trunk at first. Here we have initial on the trunk, but rapidly involving all the skin, and it occurs 1 to 4 weeks after drug commencement. Then we have blood glucose level, serum bicarbonate. We can see this. Then we have some mortality rates. Jodi, if 0 to 1 factor is present, 3%, 2 factors 12%. That person did have 1, so maybe 3% or 12%, I don't know much. So let's don't talk about the series, and we head for the further in deep into the disease. Is that the main differential diagnosis is staphylococcus scalded skin syndrome, which we studied previously, we studied previously in microbiology. Staphylococcus scalded skin syndrome, toxin mediated. Then we have main culprit in this case is drug, and so if we want to diagnose the disease, skin snip may allow early diagnosis, and if there is diagnostic doubt, then we can have a full thickness skin biopsy that should be undertaken for histology, and direct immunofluorescence in order to exclude the immunobolus or other diagnosis. And after identification, what are the common risks we have, that is sepsis and multi-organ failure. But what we should do at first when we receive such a case as what I learned from this is that first of all, admission of the patient in a dedicated dermatology ward, intensive dedicated dermatology ward. Most, I don't know if if every facilities have this, but if we receive a patient like this in emergency ward, then we can intensive care a burns, we can admit a patient in burns unit. And then treatment is mostly supportive, regular dressing, sterile dressing, and emollients, and fluid balance. We should give regular careful attention to fluid balance, and treatment of infection if it develops. And urethral and ocular involvement is common, so we should also treat them symptomatically. And in survivors, urethral or ocular scarring may be problematic, but there is no conclusive evidence that intravenous immunoglobulins, corticosteroids can improve the outcome and survival. So it's a medical emergency kind, and we can see that how the skin is blistered and it's like falling off the wound, falling off the body. And it's kind of an interesting disease to me. It's a new thing to learn today. Thank you for watching. Mite arigato.